Hello everyone, I'm Dr. Pratima Guru, your dental mentor, and today I'll be giving you a quick and easy guide to dental breeze. So what is a dental breeze? It is an artificial prosthesis or a device to replace the missing tooth. And why the tooth is missing there, it could be various reasons. For example, because of decay, because of dental abscess, because of gum disease, the patient might have lost that teeth. But if that gap is not replaced, then what could happen? So if that gap is not replaced, the main thing will be that the patient will have difficulty in chewing their food. There might be difficulty in speaking, talking, and the other problem could be aesthetic. The patient does not like their appearance because of the gap, and also the teeth could start sifting into that gap. That could lead to malocclusion, that can lead to spaces between the other teeth. So it is very important to replace that missing tooth. There are different types of devices to replace the gap. For example, there can be removable options like denture, implant, which is another fixed options. However, today we will just focus on dental breeze. So let's see what is traditional breeze. So if there is a adjacent tooth, that's the gap there, and another tooth here. So for that gap, to replace that gap, to do the traditional breeze, we need to cut that tooth 1.5 to 2 millimeter. And again here as well, we need to cut 1.5 to 2 millimeter from the tooth, depending on the type of the material that we'll be using to make the breeze. Then after that, the impression will be taken with the putty, the elastomer or the polyether, and that will be sent to the lab. The lab will make a fixed prosthesis which has an artificial tooth which will look like that. It will have a crown, it will have a pontic which are joined together, and there will be another crown. So the dental nurse will mix the lutic cement. It could be a GIC or a resin-based lutic cement, and that will be passed to the dentist. The dentist will put that into these two caps, and that will be seated here. So that will be the pontic, and that will be the cap here. So that is how the traditional breeze is done. So these two tooth which is acting to anchor the pontic, the artificial tooth, they are called abutment. Let's label as A. So that will be the abutment. The artificial tooth that is used to replace that gap is called pontic, and these caps, they are called retainer, and that is just the missing wreath. So this is another type of breeze which is called fixed movable breeze. As the name says, fixed movable, one abutment will be fixed like in the traditional breeze, and that is the pontic here. But the other side we can see it's not a fixed one like fixed connection. There is instead a joint which allows some movement to that breeze. So let's see another type of breeze which is called cantilever breeze. So cantilever breeze is a breeze in which we take the support from only one side of the teeth. This is, let's say, second molar. The first molar is missing here. Then we have second premolar, first premolar, and the canine. Now this tooth is missing. We want to replace that with a breeze. So yes, we can do the traditional breeze as well, but if we want to, or if according to the various factors, if we need to do the cantilever breeze, then how it is done, then there will be a pontic. If you remember the traditional breeze, there was a pontic and the support was taken from both sides. From that tooth as well, we were taking the support. But in cantilever breeze, we will take the support from only one side. Either we'll just take support from that side only, or we'll take the support from that side only. So let's say we are taking the support from the premolars, then what we will do is we'll make a pontic and we'll make a crown here, which is of course connected to the pontic. And sometimes if we need, we might take the second abutment as well. depending on the size and how much occlusal force will need to be taken by that tooth. So you can see here we take two abutment, however, we are just taking from one side. Yeah, so that is cantilever breeze. Instead of that, we can also do like do a crown here, and that will be holding that pontic. So that is also cantilever breeze. Now let's do a quick revision and see if you remember the types of the breezes. So what do you think? What type of breeze is picture number A, and what type of breeze we can see in picture B? Yes, so in the picture A, this is a cantilever breeze because the abutment is only on one side of the pontic. So that is the missing gap here, that is the pontic, that is the abutment, and that is the retainer. So the abutment is only on one side, it's not on the both side of the pontic. However, if we see in picture B, we can see that there is two pontic and there is two abutment. The two abutment are on the either side of the pontic, here and here, not on the same side. So they are on the either side of the pontic. So that will be the traditional or the conventional breeze. So now you know what is cantilever breeze. Now let's see what are the types of the cantilever breeze as well. So cantilever breeze is again divided into simple and spring cantilever. The earlier cantilever that we saw was the simple cantilever. The one here in the diagram is the spring cantilever. So what is the difference between the simple cantilever and the spring? So as you can see here, so that is a pontic. There was a missing teeth here, the central incisor, and this is the artificial tooth, the pontic, which is anchored by a metal and like a wing here, which wraps around the first premolar. So the abutment, so this premolar is the abutment teeth here. So if you see, the abutment teeth is far away from the pontic, not adjacent to the pontic. So that is called spring cantilever. So last but not the least, we have adhesive breeze, which is very popular and very commonly used for the anterior teeth. So in this picture, as you can see, this is the pontic that is used to replace that gap where the teeth is missing. The lateral incisors has been used as an anchor or the abutment, but instead of the full crown or the cap, the metal wing has been used here. This is also called minimal preparation breeze because either no preparation or no trimming or cutting of the tooth is required. Sometimes a minimal preparation like 0.5 to 0.7 millimeter of reduction will be done. Thank you everyone for listening to this video. If you found this video helpful, please hit the subscribe and the bell so that you never miss a video that could level up your dental skills. So make sure you don't miss the next tutorial. See you. Bye bye.